Well, hello and welcome to all of our Gold Learning family listeners. It's great to have all of you here today once again, and I'm sitting down with our guest presenter today, Nigel Lee. Welcome, Nigel. It's great to have you here at our Gold Learning family.
Thank you. It's good to be here.
Yeah, and it's so exciting because Nigel's going to be speaking very soon at our upcoming Gold Midwifery Conference. You can probably see it there in the bottom. If you're looking at your screen right now, everyone, bottom left-hand corner, that's going to give you a little bit of insight to when that conference is and what it's about. We'll talk about that at the end so that you can come and join us there, as I'm sure you're going to want to know more about the actual presentation that Nigel's going to be talking to. But first of all, we just wanted to take this opportunity to jump in and say hi to Nigel and get to know him a little bit better and find out let's going to get a little bit personal and find out a little more about where he grew up and how we happened to move into this profession. So Nigel, why don't you let us know, tell us where you are in the world and what inspired you to become a midwife?
Well, I'm currently working at the University of Queensland in Brisbane. I've been in Brisbane for quite a number of years, and prior to working for the University of Queensland, I was working at the Mater Mothers Hospital, where I'm actually currently based, and
Oh,
I've worked there as a birth midwife for about 15 years.
wow. And
Um,
so,
but
yeah, what inspired you to get there?
into midwifery,
Yeah.
it was kind of a bit accidental. I started my nursing training back in sort of 1980. And back in those days, of course, you had to be a nurse before you became a midwife in
Right.
Australia. And at the end of that, there wasn't really, because it was no university training at the time, and there wasn't really sort of much in terms of options. You could either do mental health or you could do midwifery. Um, so I chose midwifery. And just, almost for kind of day one, thought, well, this is really good. It kind of appealed to me more than just straight nursing itself, and so I've kind of pursued that ever since.
Wow, well, that's amazing. It's just sometimes how our careers and our paths take us that lead us to the things of where we are today. So that's wonderful to hear. So I'd love to know a little bit more about your ongoing work, which is about managing back pain with labor using sterile water injections. Tell me, how did you get into even looking at this for your PhD? What led you to want to know more about this?
I was working part-time as a clinical facilitator, and just we had one of my colleagues was one day sort of discussing, this article that she'd read from Sweden about sterile water injections, and she'd spoken to a couple of midwives who were working in Victoria, another part of Australia at the time, who were just sort of starting to use it. And then sort of surreptitiously, later the next day, I was actually looking after a woman in labour who had really quite severe back pain. So, my colleague and I sort of looked at each other and thought we might well give this a go. So we did, and we tried the sterile water injections on her, and they worked remarkably well. It was really interesting to watch. And she went on to birth, to be very appreciative of the fact we got rid of her back pain, and went on to birth quite well. And that sort of got me thinking after a while, that this is something we could probably work on and look at introducing. That's not necessarily an easy process.
Right.
And I was also thinking about doing a little bit of research at the time, just sort of dabbling in it, and thought, oh, well, this would be a nice little research project, and I can do that and publish, and it'll all be over by Christmas time, and I can just get on with my life. And that was about 10 years ago, which, then kind of led to other research projects and the start of my PhD. And as you said before, it all just kind of falls into place.
Hmm. That's just amazing because too, I think that, what I was reading in your bio earlier, I mean, the area that you've published in as well is normal labor progress. So this was obviously something that you intrigued you to the point, and then of course it sounds like it sort of took off like bit like a runaway train probably for a bit. I know PhD takes a tremendous amount of work, but it's led to you to where you are today, and you're ongoing working in this area. Like what's happening now? How are you utilizing it? Are you teaching or sharing the research? What's happening?
Well, it's a little bit of both. So I teach midwifery students, but also have a formal research role, and so it's research is about doing doing the research itself, but also disseminating those findings and trying to get them into clinical practice. And it if you look at the literature around this, it does take some years to sort of convert research through into sort of policy and practice itself. And in particular in the area of sort of normal labour progress, this has been an ongoing question since Friedman did his research in the 1950s, and we've kind of, here we are sort of 70 years on, and we still really don't know how far, what is a normal duration for a normal labour in a sort
Yes.
of average labouring woman.
Yes.
You would think we've got that right by now, but apparently not.
No. Yeah, it's so
And of course,
so
a lot of
interesting.
our work on the birth suite is really centered around how long a woman actually labors for. So, and if we don't really know that, then that presents a whole sort of considerable variation in the way that this problem is approached.
Hmm.
And so, there has been a lot of work around developing different guidelines. And we teamed up with a number of those researchers, Zhang from China um, and Jeremy Neal and Nancy Lowe from the US, to start looking at how we could actually sort of develop this into uh, a randomized control trial. So we ran a very small sort of pilot trial to look at
Right.
how the documentation might be accepted by clinicians and looking at feasibility uh, and whether it would actually sort of variations of it would actually work on the birth suite. So we
Hmm.
published that very small trial, and we've continued to sort of look for funding to sort of to run a much larger study in that area.
Right. Right. Yeah. I mean, it certainly comes doing research, policy making, and so forth and so on. Certainly comes with some big stepping stones at times, red tape, funding, so forth and so on. I mean, many of us have been there before. I mean, some of my frustrations, Nigel, just at the core elements, as we were talking offline, I mentioned to Nigel that, I've been very fortunate to work as a doula and seen, sterile water injections work well. I've seen them utilized, et cetera, by some great physicians and with some midwives. What I didn't tell you, Nigel, was unfortunately, it's still very far and few between. And there's lots of people that don't do them for whatever reason because they don't have the information, they're too afraid. Again, probably no policy in place. But it's not, it's been around for a while. It seems like it's been around for a while, and now is it a bit out of fashion? And, is it going back in? Like, what are we doing? Why can't we just get more of these things in place? Because normal labor is something that we're really striving towards and we're hungry for, and so are our clients, right?
Oh, exactly, and you're quite right. It has been around. It's been around used in maternity care since probably the late 1970s,
Mm,
and it's been around in healthcare since the late 1870s when it was first used. But I
right,
think it's it's part of the problem. I think is almost the simplicity of the procedure itself.
right,
It's trying to convince people that just injecting a few drops of water under the skin of someone's back is actually going to make a difference or a significant difference to their pain. And when
mm,
you talk about it, they kind of look at you and think, no, no, that's not
right,
going to work. Or they think, oh, it's just got to be a placebo. We don't really want to be giving
right,
people injections of things like saline and water when then it can't work, and we're just telling them it will, and that it's not true. Part of the difficulty is actually convincing them that there is actually a physiological response, and that it is actually an evidence-based procedure that will actually provide women with, significant relief to their back pain during labour.
right. Well, it seems now that if we're moving away from a medical birth, that this is something that, although medical based, it's not a high intervention, minimal side effects, etc. That is really good for that physiological normal birth moving forward, where that patient may not need other interventions. So it really could be, in many respects, saving the labor, supporting and managing it really in a healthy manner.
Oh, absolutely. And it's, you know, women will often sort of talk about back pain as something they weren't expecting, they haven't actually planned for. It often catches them by surprise and and really sort of interrupts their sort of the plan they had for coping with birth. Um, so if you can kind of relieve that, you can literally get them back on track. They have that idea that yes, I can actually do this. Uh, and that's often what comment that women will say to you is, they just had to get rid of that back pain. Now I can actually sort of get on with my plan and move around and maintain that mobility and avoid that epidural, of course, which brings with it a whole lot of other issues in
Yes.
terms of achieving a normal birth.
Yeah, absolutely. Absolutely. Well, I mean, I'm very excited to hear that, that you're moving it forward into a bigger trial, and because without those today, unfortunately, it is difficult to get things passed through into facilities particularly. And and possibly even used outside of midwifery care. Of course, we have a slightly different model of midwifery care here, in Canada, which is where I'm based right now. The same as, slightly different in the UK and the US. So we're all a little bit different, but utilizing, some really good pain relief that doesn't come with the complications as we mentioned is really just going to support families moving forward and what their needs and meeting their needs during that labor plan.
Oh, yes, absolutely.
Yeah, just fabulous. Well, thank you so much, Nigel. I really can't wait to hear more because I know behind the screen here with that title on there, Managing Back Pain in Labor Using Sterile Water Injections, there is more. So there's more to come, folks. Do join us for that full presentation. Nigel's going to be speaking. Well, I was going to tell you the date, but it's going to be different for everyone. You need to go to the website goldmidwifery.com. You can register now. That's right now, and you'll have the opportunity to join us not only at the beginning of the conference on February 4th. That will be our opening and live keynote, and then Nigel's going to be speaking during the conference as well, so you can check out your local time as well. Thank you so much, Nigel Lee, for joining me here today and chatting a little bit more about your experience and, of course, this upcoming presentation.
Oh, thank you very much, and thank you for the opportunity.
Yeah, it's wonderful. And thank you again to our listening family. I hope you've enjoyed listening and learning a little bit more about the use of sterile water injections and, of course, listening in to a little bit about Nigel Lee. Thanks again, everyone, and have a wonderful day. Bye-bye for now.